Hey guys, I'm going to talk to you about my sebaceous hyperplasia and the treatment I got for it called Skin Classic. So through my adult life, I had these bumps on my face, and for the longest time I didn't know what they were, and they are flesh colored bumps, and on me they look a little bit flat in the center, and they're not really like pimples, but they do have a buildup of excess skin cells and oil that clogs up the pore, and sometimes you can squeeze some of that out of there, but you can never get all of it out, and then it will just fill up again. So it's really annoying, and I would go to the dermatologist every now and then, and the only thing they would do is use liquid nitrogen, and they would do maybe 1 or 2 bumps. And it is very painful, and it's very expensive really to treat like that, and sometimes it didn't even work. Anyway, so after one of these trips to the dermatologist, she wrote down that it was sebaceous hyperplasia, and that was the first time that I had heard that term. I really didn't know what I was dealing with. So that was, maybe 6 or 7 years ago. And so then I just started to do some research, trying to find out if there were better treatments, more effective treatments, just whatever I could. And eventually I found some YouTube videos on the Skin Classic machine. And they have some really good videos. It treats a variety of skin irregularities. And I will put a chart up so that you can see what I'm talking about. And I was fortunate enough to find a provider in my area because this machine is not found at a dermatologist's office. I'm not sure if they're aware of it or they just don't want to buy the machine because sebaceous hyperplasia affects a small percentage of the population, and it's probably not cost effective for them to have a machine like that. Plus, when they can charge you for a visit just to get 1 or 2 bumps off, and it's $100 at least, I mean, why make it easier? It's not going to benefit them to make it quicker and easier. So anyway, I had my first treatment about 5 years ago, and at the time I did a blog post on it, and I took pictures, but I didn't do a video. And so I get a lot of questions about, if you get marks on your face, how long does it take for them to fade? So I thought it would be helpful to do a video. Right now, it's been just a little over a month since the treatment, and yes, I am wearing a full face of makeup. But you are going to see my bare skin in the upcoming video clips. Next, you're going to see my skin with the bumps outlined in eyeliner because it is very hard to photograph. So just to give you an idea of how many I have and had and where they were. Well, it's the day before my Skin Classic treatment, and I just wanted to show you my skin before I had the treatment done. The thing about sebaceous hyperplasia is that the bumps, they were really not red. You can just see them, upraised or whatever. So what I've done is I've outlined the big ones in eyeliner so that you can see what I'm concerned about here, because it is very hard to photograph before and after. But I mean, when I'm doing my makeup in the mirror, and I see, in the light, I can see these bumps on my skin, and it just really bothers me. So I'm going to try and get closer so that you can maybe see that. Now I am wearing a little eyeshadow, but I'm not wearing any foundation or concealer. And you can probably tell because I look like a fright. Anyway, I have just a couple of spots on my forehead, and underneath my eyes I have a couple things, and for some reason my right cheek, it's got more spots on it. These were bumps that did not get taken off the first time. And I just have a couple on the other side. And I'd just like to point out that any other discoloration that you see on my skin is just from freckles or moles or hyperpigmentation or whatever. It's not sebaceous hyperplasia. Okay, so I'm just getting ready to go to my appointment, and I do have eye makeup on, but I don't have any foundation or concealer on. I'm going to try and give you a good look at my skin. So these are the bumps over here that really bug me, and then there's one on my chin. Those are the ones that have been hanging around the longest. Anyway, this is my second Skin Classic treatment. About 5 years ago, I went for the first time, and when I start doing the treatment, your skin starts to get a little irritated, and since the bumps are usually clustered together, some of them get missed, and that's what happened here, is that some of them were missed. I'm not sure if I've developed new ones in the last 5 years. It's possible, but I know the ones that bother me the most are the ones that have been hanging around for the longest. And the way this machine works, it uses a radio frequency, and they just kind of hover it, or just, they don't, it just goes on top of the skin. It doesn't go inside or inject it in. And then the sebum heats up, and then it squirts out of the pore. And then you're left with a little scab, and that takes some time to heal. And after the scab falls off, then there's a kind of a red mark, and that takes that could take a few weeks to actually fade. And if you've had a scab or a pimple, it's the same thing. You get marks on your skin, it just takes a while to fade. Also, the Skin Classic machine will treat other abnormalities like skin tags, a cherry angioma. I can't think of some more. Anyway, I do have a skin tag and a cherry angioma that I want taken off also, but not on my face. So anyway, I better head on out, and I will see you after the treatment. I just got out of the office. I'm sitting in my car, so I wanted to show you what my skin looks like after having a few of those bumps taken off. I look a little beat up. Anyway, I'm on to do some shopping now. Okay, I'm back at home now. It's been about 2 hours since I left the salon. And I just want to tell you a little bit about how it went. I did not want the full Skin Classic facial, which involves, I think, massaging and microdermabrasion and I don't know what all. I just wanted her to zap all my spots, and she cleaned my face, and I don't know, she put some stuff on it, maybe some alcohol or something, I don't know what, and covered my eyes, and then she started working, and it felt like a needle going into my skin, but of course that's not how it works, and it hurt for just a second, and I mean, not like real bad or anything, but that's how it feels. And so she did on my face and got a few spots I didn't even see. And then the other spots that I had, one was on my chest and a skin tag under my arm. That one really hurt. But once again, it only lasted for, a second or two. And so, I don't know, when I was out shopping, my skin looked more like a sunburn. It was just more overall red, and it's calmed down just a little bit. But I think you can still see the spots that I have going on. So anyway, it cost $300, and that's more than I paid last time. I don't know exactly why, but anyway, I'm hoping that I won't have to come back again. In the meantime, since between my first and second treatments, I've been trying to do research, trying to figure out what causes this, and I did come up recently with the answer that it's caused by insulin resistance. Now, for the last 2.5 years, I've been on a keto diet, so I'm assuming that my insulin resistance is under control. I don't know that I've gotten any new sebaceous hyperplasia bumps in the last, in that time period. So we'll see going forward. And also, skin tags are supposed to be as a result of that. And I know a few years ago, my younger adult life, I did have a lot of skin tags, and I didn't know what caused it. So I guess that kind of makes sense, since I was eating more like a standard American diet, But anyway, that's about it. I'm going to be checking in every day so you can see what happens to my skin day to day. So I'll talk to you later. Good morning. It's day 2, the day after my Skin Classic treatment. And take a look at my skin. I'm going to get a little closer. And I wanted to talk a little bit more about the treatment that I got yesterday. I did say how it hurt for just a second, and really after that point there's no pain involved. I've had treatments where they used liquid nitrogen on me, and it really hurts. It hurts for a long time, like days. It hurts. So, and I haven't had electrocautery, but I imagine it would be pretty much the same thing. So this, even though, it hurt for just a second, there's no pain at all afterwards. And I don't really think it's looking too terribly bad. If I wanted to, I could put makeup on my face. And by the way, I am wearing eye makeup, but I'm not wearing any foundation or concealer. And so I'm not going to put face makeup on today because I'm just going to hang around the house. And one of the things they say to do is to wear sunscreen, and I don't wear sunscreen. I don't believe in it. I think it's unhealthy and unnatural, and also the chemicals that are used in sunscreen I think are dangerous. So I think the better thing is to be out in the sun, and the sun is life. So I disagree with common wisdom. I disagree with it completely. So anyway, the other thing is I don't do anything special to my face as far as washing it or putting on my serums. I'm still using my serums in the morning and at night. And I generally will just use, sometimes I use witch hazel to clean off my skin, or just maybe some plain water. And that's about it. That's all I'm doing, and I will check in with you tomorrow. Hey guys, it's day 3 and it's Saturday, which means I get to go dancing, but not looking like this. So I just wanted to give you a skin update. And of course I do have my eye makeup on. And I'm going to come in for a closer look. So anyway, I'm going to be putting on my foundation and concealer, and I think I'll show you what it looks like, and hopefully I'll be able to cover up all these spots. And the only other thing I wanted to mention was that I guess it should go without saying, but probably has to be said, that if you get this treatment, that when you start to get scabs here, that it's important not to pick at them. And mine actually haven't gotten to that point. They are still, some of them are starting to get a little crusty here, but you know, they're not far enough along. But I definitely do not pick at the scabs. I let them fall off naturally, and that does take some time, especially for the bigger spots. Some of the little ones, you know, they heal up faster. Well, anyway, that's all I have for the moment, and I'm going to put some makeup on and show you what it looks like afterwards. Okay, I'm back, and I think I did a pretty good job covering up all those spots. Of course, when you get close, you can see it's kind of crusty on there, which is yucky, but I'm glad I'm going to be in the dark. Well, kind of. It's a dark place where we go dancing. So anyway, this is what I used to cover it up. My foundation is Revlon Color Stay, and this is a Maybelline, it's an Age Rewind Concealer. And that's all I used, and can't wait to get out of the house. So I will see you tomorrow. Hey guys, it's day 4, and here is my check-in. I'm going to get a little closer now. So last night I was really careful about removing my foundation because that Revlon Color Stay is very hard to get off, and I didn't want to disturb the scab, so I used some baby oil and it just dissolved right away, and then I followed up with soap and water in a washcloth, but did not tear off any of my scabs. And today is Sunday, and this is the day that I always do a micro needling treatment, and sometimes I do it during the week, but Sunday I do use longer needles. So obviously I am not going to be doing that, and that is the only kind of beauty guru-ish thing that I subscribe to, and I'm not even sure that how helpful it is, but I've just been doing it anyway. So I'm going to go out today, and I am going to put on some more makeup because it just makes me feel better. But I will check in tomorrow. Hey guys, it's day 5, and I feel like my spots are just maybe a little less red than they used to be, but I'm going to come in for a closer look. And that's about it. I will check in with you tomorrow. Hey guys, today is day 6, and a few of my scabs have fallen off, like right here and on my chin. And you can see I still have spots underneath. That's normal, so they're a little pink, but they are lighter, and it's going to be easier to cover up with makeup. So I'm going to come in for a closer view. And that's it for the daily update. Tomorrow I'll be back for another one. Well, here we are at day 7, and I'm going to give you a closer look at my spots. Most of the scabs have come off, so I'd say about 3/4 of them. And then this over here is just this a little itchy bump that came up, but that'll go away in a couple of hours. So I'm going to come in for a closer look. Okay, so now I'm not going to be doing any more daily updates. I'm going to come back a week from today and show you what the marks look like on my skin. Hopefully they are really faded by then. So I will see you in a week. Hey guys, it's day 14, so it's been 1 week since my last check-in, and as usual I have some eye makeup on but no foundation or concealer. So I'm going to come in so you can get a closer look. So at this point, just about all the scabs have fallen off. I think there are maybe 1 or 2 left. And then for this mark down here, I accidentally scratched it, and it didn't bleed or anything, but it just got a little darker because the skin underneath the scabs is very delicate. So anyway, this is normal. And one thing I forgot to mention before, that after the treatment, sometimes you can have little indentations in your skin. Last time I had it done, I think I had 1 or 2, and they did fill in after a while. You know, a couple of months, I think. Very slight. And this time I didn't get any indentations. And as a side note, I have not done any derma rolling since I had this done, so 2 weeks without derma rolling. I really can't tell any difference, except that maybe my skin looks a little less irritated because especially in this area, when I would do it has some longer needles I would do here, and then it was like flaky and stuff, so I don't know that really is helping me any. But that's about all I have for right now, and I will check in next week. It's day 21. I'm back for another spot check. Most of them have faded quite well. I still have a couple, 2 or 3 or 4, that are still very visible without makeup. And once again, I'm only wearing eye makeup. I'm not wearing foundation or concealer. So I will come in for a closer look. Well, I hope you could see that. Most of the spots have faded quite well, and I just have about 3 or 4 that are still kind of dark, and a couple of them, like here and here, I rubbed them a little too hard, and the skin under there is just really delicate. It kind of bruised it a little bit. So anyway, don't do that. I will maybe check in another week and see how things are going. I'm hoping by that time they will have faded and then you won't be able to see anything without makeup. And once again, yeah, I'm only wearing eye makeup. I'm not wearing foundation or concealer. So I will see you again. Hey guys, it's day 28, and here's my check-in. And once again, I'm not wearing any face makeup, just eye makeup. So I don't know if you can tell, but I still have a few spots that are very, very faint now, and somehow I managed not to scratch or rub them, so hopefully within the next week or so they will be completely gone. I think this is going to be my final check-in, so I'm going to come in for a closer look. So I would just like to add that during these past 4 weeks I haven't done any derma rolling, when I was doing it just about every day, and I honestly can't tell any difference. So anyway, as far as the Skin Classic treatment goes, this is it, and I hope you enjoyed watching my results. Okay, final thoughts. Well, this Skin Classic treatment is the best thing that I have found to treat sebaceous hyperplasia, but it's not perfect, and for the reasons that I discussed earlier, that if you have clusters of pores that are affected, they likely are going to miss some, because once they start getting going, the skin starts to get irritated. It's hard to see each individual bump, but I don't know of any other treatment that works as well as this. And I do recommend that you try the Skin Classic treatment. I think you're going to be happy with the results. And please let me know if you have any questions or comments, because I'm here to help you. So I hope you are having a good day, and we'll see you next time. Bye.